Hi there, I'm Winch. I'm a health economist at the Global Fund. I would say there's four numbers to keep in mind when it comes to health financing in the Africa region. The first one is 86. That's the number of dollars per capita on an annual basis the World Bank estimates it costs for an essential package of basic health services. The second number is 62, and that's the number of dollars on average that governments spend in Africa on health. It's lower than the $86, and this number is also hugely variable. It goes between $3 per capita right up to $620 per capita in the Seychelles. So what makes up that shortfall often is usually external financing for health and other private sources, but largely household out-of-pocket spending. That's probably the least efficient way to finance healthcare services. The third number is 15. That's a percentage. It's the target for governments to allocate to the health sector as a percentage of their total budget. It was made in 2001 as part of the Abuja Declaration over 20 years ago. But the last one, and probably the most important number, is 0. And that's the number according to this year's most recent health accounts data that in Africa are meeting the Abuja Declaration target 15%, so 0 countries. So in terms of advocacy messages, I think it's important to take away maybe 4. The first is that health is wealth. A healthy population drives economic growth. It's the foundations for a more prosperous and equal society. And COVID's really highlighted that if you don't have an effective health system which can respond to emerging threats, it's the economy which is the one that suffers. It's people's livelihoods, people's jobs, which are impacted. So health is really an investment and not a cost. So that's the main, I would say, the first message there. The second one is that it's important when we're advocating to spend what's already allocated in the health sector. It's too easy for a Minister of Finance to make cuts in sectors where the money faces challenges in getting to frontline health services. Many countries do face the challenges, either underspending or overspending the budgets that's allocated. So financing reforms around budgeting and building robust public financial management systems are really important. The third message is around investing better. So here it's not necessarily knowing all the answers, but making sure that any government decision makers are using economic evidence that's available to them to make informed and transparent decisions and accountable to those decisions in the health budget. It's no use, for example, having a brand new hospital if you don't have the funds to pay for the staff. And likewise, if you're paying for the most expensive, new, innovative cancer treatments, it's no use funding those for a very small minority in an urban hospital where there's healthcare facilities out in rural areas that are still suffering stockouts of basic medical supplies. So the last message I think it's useful to focus on is around sustaining. And that's both in terms of sustaining the additional levels of health financing that there's been during the COVID pandemic, and also sustaining the political momentum that there's been around health financing discourse in order to build back better and more resilient health systems in the continent. Growth has gone down, the tax receipts in many countries have also gone down, and the pressures on government budgets are increasing. This is an important area to focus on for advocacy.